In the past, my colleagues and I have conducted studies into the brain basis of autism, where we've examined actually one of the core symptoms of autism. Autism is comprised of three clusters of symptoms. One is severe social impairments, the second is impairments in communication, and the third is repetitive and restrictive behaviors. And we actually focused on the third cluster of symptoms, the repetitive, stereotyped, restrictive behaviors. And we modeled those behaviors, simulated an alternation of behaviors while participants were scanned using functional magnetic resonance imaging, which allows us to examine the different patterns of brain activity while people are engaged in mental activities inside the MRI scanner. So we use that technology to examine repetitive behaviors and the inability to alter repetitive behaviors in autism. And we found that compared with a group of typically developing individuals, the individuals with autism had deficiencies in function in three key brain areas that are all part of the brain's inhibitory network and part of the brain's attention and executive functioning network. There is this new study that came out this week in the journal PEDIATRICS examining the potential prevalence of autism in various community settings. And what the researchers did was they did a telephone survey of parents nationwide and asked the parents if their child or children were diagnosed with autism or autism spectrum disorders. And the researchers found that overall that approximately 1 in 100 individuals are diagnosed with autism as opposed to the previous estimate of 1 in 150. And it's an interesting study and a very provocative study. But the key word is diagnosed with autism and not necessarily have autism. In terms of the prevalence of autism, I'm actually going to go back 20 years. In the 1980s, autism was considered to be a very rare disorder. Maybe 1 in 10,000 children were diagnosed with autism. In fact, in the late 80s, early 90s, it was raised to 1 in 5,000. Then by the year 2000, it was 1 in 2,000. By the year 2002, 2003, it became 1 in 1,000, and then all of a sudden in the last 5 to 6 years, the diagnosis exploded to 1 in 166, then 1 in 150, and now 1 in 100. Mental disorders in general are very, very difficult to diagnose, and especially to diagnose in a method that we call differential diagnosis, which is saying that the child has autism as opposed to obsessive compulsive disorder, as opposed to ADHD or attention deficit hyperactivity, as opposed to any other possible disorder that the child can have. And the problem in general is that the symptoms of many childhood disorders overlap. And it's very, very difficult to make a differential diagnosis. And it often takes 2 to 3 hours of observation to properly diagnose a child with a particular disorder as opposed to another disorder. So when the study comes out that says that 1 in 100 children have autism, you kind of have to take that figure with a little bit of a grain of salt. The question is, are these kids being diagnosed with autism correctly? And if they are being diagnosed correctly, what type of autism do they have? It used to be that autism referred to a very specialized form of a disorder with 3 key characteristics. As I mentioned before, severe impairments in social interactions, severe impairments in communication, and also severe impairments in the form of restrictive and repetitive behaviors. There has been actually a very big shift in the way autism diagnoses are made. Nowadays, autism is being diagnosed as what we call a spectrum disorder, which is a very heterogeneous term for a cluster of disorders, which includes the old school autism, but now it includes a disorder called Asperger's syndrome, which is a very mild form of autism, and it also includes a disorder called Fragile X, which is a genetic disorder, and it also includes a disorder called pervasive developmental disorders, which is a general term for any individual who is not developing on the proper spectrum of normative or typical development. So whereas before you had a very small proportion of people being diagnosed with what was autism, now you have a very large proportion of the population being diagnosed with the spectrum disorder. So when you say what is the interpretation of this study, it's very hard to know. It's hard to know whether the number of cases of autism are rising in general, or whether people who would have simply been diagnosed with a different disorder are now being diagnosed with an autism spectrum disorder. The first piece of advice is if your child is diagnosed with an autism spectrum disorder, intervention is a must. And the earlier the intervention, the better the outcome. And unfortunately, right now, there aren't too many interventions that work, that have solid scientific evidence showing that they work, except for one intervention, and that is social skills training. Over at the SALTZMAN Center, there is a Center for Autism-Based Disorders, and the center is headed by Dr. Kim Gilbert, who is also an assistant professor in the Hofstra Psychology Department. The way that her clinic works is that children can come in, or parents of children who have previously been diagnosed with autism, or parents who suspect that their child has an autism spectrum disorder, can come in for a full evaluation, which usually involves 2 to 3 hours of observation. There are 2 diagnostic scales that are used during these play observations. And that way the diagnosis can actually be confirmed or disconfirmed. And if the diagnosis is confirmed, then Dr. Gilbert heads up these social skills play groups where several children can get together at once. And usually there are 2 or 3 children diagnosed with autism, and then 2 or 3 aged match control children, or typically developing children. And the children with autism learn the social cues from the typically developing children. Dr. Gilbert and her clinical associates will use directive play therapy to engage the children with autism so that they learn what are the social give and take rules. How do you interact with other children? How do you place a bid when you want to play with other children? Because these are the deficits that children with autism often have. When the children get involved in these groups early on, it really teaches them the social skills necessary to overcome, I wouldn't say cure their disorder, because there certainly is no cure for autism right now, but overcome some of the social impairments that impede them on a daily basis.